economists say the banning and regulation of smoking in South Africa could cost the economy an estimated 3 billion rand and the loss of thousands of jobs. But 350 organizations from over 100 countries say that if left unchecked, tobacco use will kill 8 million people a year by 2030, 70% of them in developing countries. Joining us now in studio is Leon Louw, Executive Director of the Free Market Foundation. And over in Lagos, we have Rachel Kitonyo from the Framework Convention Alliance for Tobacco Control. A very warm welcome to both of you. I'm going to start it right here in Joburg with Leon. Leon, thank you so much for joining us. And Rachel, thank you for joining us. But we are going to start here with Leon. Leon, reading through some of the things that you sent me and where your stand is, more than anything, it's not that you are for tobacco, that you are for the industry, you are for freedom more than anything. And you say that in a free society, people should be allowed to choose what they decide to do.
Yes, let me make it very clear. I personally am a lifelong anti-smoker, so I demand absolute protection from other people's smoke. But I can't expect my right to that freedom to be honoured if I don't equally demand the right of smokers to smoke. You know, it's the same with everything. Everyone has the right to sex, but not to rape. It's absolute. So you should have complete and mutual freedom. And the trouble with what is happening now, up to now, the law has been informed by a desire to protect anti-smokers. Now it is going much further, and a direct interference with the freedom and lifestyle choices and risks of smokers, and actually makes it worse for non-smokers. At the moment, I'm perfectly adequately protected by indoor smoking areas that are properly ventilated, but this law will force smokers out onto the sidewalks where I will no longer be protected from them, so non-smokers will be worse off. And what's more, force people to socialize and gather more and spend more time in their homes during evenings when they might have gone out to a club or a restaurant or a pub, where they will impose on children and domestic workers.
But I mean, I want to talk a little bit about the hospitality industry, because that is something that you highlighted in your research, and it seems as though we don't have Rachel in Lagos, so we are going to keep it here in Joburg for the meantime. And what I wanted to ask you is, looking at the hospitality industry, you do have restaurants, for instance, that do not have, I mean, just generally their model is that they do not serve alcohol, they do not serve tobacco, and those restaurants seem to do quite well.
Yes, it's perfectly in order, absolutely as it should be. I was in a restaurant 2 nights ago in Park View, a place near here, and I won't name it, although I'm tempted to, where there was smoking everywhere. It was awful, it was terrible. I couldn't wait to get out, and I, as a non-smoker and as a consumer, will simply fire them without notice. I won't go there again. I absolutely defend their right to do that. Equally, I defend the right of people who have no smoking. You see, the point is, freedom means that you don't impose your will on other people, and that everyone has freedom of choice and association.
I want to quote something that you said in one of the papers that you wrote. You were talking about this: elected officials are not appointed to tell us how we're supposed to live our lives or what habits we are supposed to follow. And you say that this regulation in South Africa that would in essence, you know, ban smoking the way that we know it, is one more step on the road to a nanny state.
Yes, we're well into a nanny state, and the interesting thing is, where do people learn to smoke now? And the answer is mostly at school, and that is in the hands of the nanny state. That's where people learn to smoke. And so, yes, this is now, it's no longer a case of protection. And I want all non-smokers to understand this very perfectly. This is not about protecting non-smokers. And the normal knee-jerk reaction that an anti-smoking measure is good if you're a non-smoker isn't appropriate here. This is now about a direct interference with a personal lifestyle choice of people. And if we allow this to happen, then there is no stopping it. The next, of course, will be liquor and gambling and dangerous recreations and unprotected sex and eating junk food and salt and sugar and so on.
But what you said when you were calling, I mean, when I read your paper and you were calling on people to actually protest this, I would imagine, you were saying that this is a warning that our freedoms, all of our freedoms, are at risk.
Yes, this is the beginning. This is not even the thin edge of the wedge, a thick edge of the wedge. And if this is allowed, then you can never complain again for any interference with your personal lifestyle.
What I do have to highlight,
then the principle is lost forever.
What I do have to highlight, though, is that it's not just South Africa. This is a global phenomenon. This is being debated across the globe. So what I'm trying to say here is that it's not just about the South African government right now. This is an issue that is being debated in the US, it's being debated in Europe, it's being debated pretty much all over the world.
Yes, the approach in different countries differs enormously from one to another, and many of them, for example, work on the basis of persuasion, warnings, education and so on, warnings on packets, and sometimes in quite extreme forms like the proposal in Australia to ban branding on packets. That's a different issue, and in many countries the issue is about protecting non-smokers, and then in some countries there's this nanny state idea, as in, for example, Ireland, where they have already banned all indoor smoking, the result of which is many small businesses, restaurants, pubs, bars go under because people just don't go there anymore if they can't enjoy a smoke and a drink.
I wanted to take it to Lagos now. We do have Rachel back. Rachel, thank you so much. I don't know if you were able to pick up on some of the conversation that we just had, but one of the things that Leon is saying is that it's not just an issue, well, and he's talking about perhaps here in South Africa, that it's not just an issue about anti-smoking. It's an issue about freedom in any society, that people should have the right to choose, and government should not be telling people which habits they can continue with and which habits not to. What is your response to that?
Well, it's not really an issue of freedom. If you look at when people start smoking, they pick up this habit as children. Can you really say that children can exercise freedom to choose? And so when the tobacco industry markets use of flavored products and advertisements, you're talking to people who can't really make a choice. So it's not really a question of freedom to choose. In addition to which, when you look at the right to health overrides personal freedoms and choices of people.
I want to highlight on that issue that you're bringing in about children. How much of that, because it's not, when we look at what the UN has said, when we look at, I'm going to read now something that the World Bank had said just in terms of how they will not fund, businesses related to the tobacco industry. But I want to focus on that children. Very little is being said about targeting that this legislation will only be to ban children. It's a blanket ban. This is what my understanding is from what I'm reading.
Well, when you talk about smoking, so right now in Africa, the bulk of smokers are adults, and then you look at the issue of secondhand smoke, and so the people who are affected by secondhand smoking tend to be the wives and the children. And so when you talk about a ban of smoking in public places, there's an extent to which you are protecting children and wives who have chosen not to smoke. And then when you look at the other things that are contained in South Africa's legislation, so things like bans to advertising and so on, there's a clear dimension of protecting children. But even if it's not children, there's a right to protect non-smokers from tobacco smoke. And so the South African Constitution does provide for a right to a clean and a healthy environment, and cigarette smoke destroys that right.
Rachel, I want to come into that thing about Constitution, because there are some organizations that have said this is actually unconstitutional, because you are talking about people that are not smoking, but regulation in South Africa has made it that you cannot, I mean, in the workplace, even if you go to restaurants, you cannot be smoking in just an open place. There are designated places for smokers. So what I'd like to ask you here is that what about the rights, and this is what Leon is arguing, what about the freedom to do what the smoker wants to do? Are their rights not being infringed on?
Well, if you look at the South African Constitution, the Bill of Rights in particular, it has clear rights that belong to non-smokers. And so, as I've said, you've got in Section 11 the right to life, and then there's also a right to a clean and healthy environment. But reading through the Bill of Rights, I don't see any right to smoke. And so when I hear about smokers' rights, I wonder, where do those rights come from? Because if those rights are not enshrined in law, then they don't exist. And so when government is taking measures to protect clearly articulated rights to clean air, which are contained in the Constitution, and there is no subsequent right that is given to smokers, the South African Supreme Court has actually held that the rights of non-smokers outweigh the interests of smokers. And so smokers have interests, non-smokers have got rights. And it is those rights that the government of South Africa is trying to protect.
Leon, how would you respond to that?
Well, a number of issues Rachel has raised. Let me first make the point about children. There is absolutely nothing in this bill, in this draft regulation about children. On the contrary, it makes things much worse for children because it allows the only indoor place that it will be lawful to smoke in future will be in the home. And what will happen is when people are not allowed to go out and smoke, they will obviously socialize more and stay home more. This will directly expose children to a substantial increase in exposure to secondhand tobacco smoke, and not just children, but also domestic workers. As far as protecting people to a clean and healthy environment, this bill does exactly the opposite of that. At the moment, we are protected by having indoor, properly ventilated smoking areas. This bill says you have to be outdoors on a sidewalk, effectively. You have to be in a public place where there is now clean air, and in future will not be clean air.
But also I think there's about 10 meters. You cannot be 10
Well,
meters
it says you have to be
window.
10 meters from a door or a serviceable window, nobody knows what that means, or a ventilator or an entrance, apparently not an exit, which is again odd. But anyway, 10 meters from any door or window. In a place like Rocky Street in Yeovil or Long Street in Cape Town, or any township or location or settlement in South Africa, 10 meters from one door or window or ventilators in front of another one. So you can't do it. But nonetheless, this building we are in right now, no one will be able to smoke anywhere on this property. They will have to walk out onto the pavement, which is exactly the opposite of the right to a clean environment. It actually makes the environment less clean and less safe.
One of the things that I do want to bring into this is the debate about economics, because has been a huge thing that the tobacco industry has said. The economies are going to lose so many jobs are going to be lost. I would like to read a 1991 World Bank policy that was adopted, and here's the World Bank saying that tobacco consumption provides a net economic loss, and anti-tobacco policies are a cost-effective way to save lives and benefit the economy. And what they're saying there is they're not pro the tobacco industry. So in terms of, and this is the global, we're talking about the World Bank here, who do not see economic benefit in the tobacco industry. How would you respond?
I am no more in favor of the tobacco industry than in favor of the junk food industry or the motor industry, which kills many more people on roads and so on. The question is not about the industry, and I really don't care about the industry. I do care about the right of people who work in the industry, the people who distribute and sell tobacco products, and more importantly and most importantly, the people who smoke. To say they don't have rights is really quite strange. To treat them like lepers is clearly a violation of Section 10 of the Constitution, which says they have the right to dignity.
I want to go back to Rachel. Rachel, what I do want to ask you is I was asking Leon about just the economy debate, because that is something that the tobacco industry has come up with, and they've said that some economies that really depend on the tobacco industry are going to be hit hard, jobs are going to be lost. When you hear the tobacco industry argue like that, what is your comeback?
Well, my response is that overall, tobacco control is good for the economy. When you look at the figures that the tobacco industry would like to talk about, let's take Malawi, for example. Malawi is one of the least developed countries in Africa and indeed in the world, yet they are heavily reliant on tobacco. So if this tobacco that they are growing is a cash crop, why are they so poor? And so any government that's interested in poverty eradication, and all African governments are interested in that, need to start asking themselves whether tobacco is really a cash crop, and if it's a cash crop for who? And so at the farmer level, most African tobacco farmers are that poor. Their children don't wear shoes, their children don't go to school because they're pulled out of school to work in the farms. They have high rates of miscarriage, they get sick from the crop that they grow. So is this really a cash crop? And if it's a cash crop for who? And even if you look at the United States that has decreased their acreage of tobacco, you can hardly say that the United States economy has crashed because of decreasing tobacco acreage. And so for countries that have implemented tobacco control policies, if you take South Africa, for example, the South African economy is not dependent on tobacco. You can't say that it grew because of tobacco. And actually, because of successful implementation of tobacco control policies, not only is the Treasury making money from tobacco tax increases, but they are saving money from the lives that are being saved as people stop smoking. And so the overall net effect is more money for the smoker as he spends less on a destructive habit, more money for the Treasury as they get more revenue and spend less on healthcare, and then better lives and better health and outcomes for the population.
But Rachel, how far do you take tobacco control? In your view, you are very anti-tobacco. How far would you like to see countries take anti-tobacco laws?
Well, we don't tend to have this kind of discussion about mosquitoes and malaria and say how far do we take the mosquito When you've got a mosquito, you kill it because it's causing malaria, and malaria kills people. And so when you look at tobacco use, there is no positive health benefit from smoking tobacco. Eventually, the economic benefit is a net loss because you spend more than you gain. And so how far I take it is to ask governments a question: how far do you take the lives of your citizens? How much do you take the economic development of your nations? And any government that is serious about protecting its citizens must be serious about tobacco control. So it's really a question of life and health. And that's how seriously I take it, and I'm hoping our African governments take it that seriously too.
Leon, what I do want to ask you is, one of the things that you were concerned about when it came to enforcing this law in South Africa was you didn't see how it was going to be enforced. And then you were saying that what that does is, if there's a law that you cannot enforce and people can easily break it, you are at risk of raising a generation that has got a disregard for the law. I would like to just ask you a little bit about that, because it does sound like a pretty strong statement to make about one portion of South Africa's legal framework, I would imagine.
I would be very surprised if anyone thinks this law is going to be enforced for the majority of South Africans, that middle and low income people who are living in places where if they wanted to find somewhere lawful to smoke, they might have to walk many kilometers to get out of Alexandra Township, for example. Let me just make this point about health, because I can't let this go unanswered. The fact is that tobacco contributes more to government revenue than is spent on caring for people suffering from tobacco-related illnesses. And as for benefits, smoking obviously has lots of benefits. The most obvious and conspicuous one is that people enjoy it.
But the research that was found, I don't have research for South Africa, but the research was found in the US, just in terms of how much revenue, and this is government revenue, the tobacco industry in the US made, compared to how much the government had to spend in terms of educating people to not smoke, in terms of helping the people, you know, that are in healthcare, that the government was actually spending more in counteracting the tobacco industry's effects.
Yes, let me just immediately say, we don't hear this argument in regard to junk food, sugar, salt, coffee, dangerous recreations, motor car driving, and so on and so, unprotected sex, and so on. So why is tobacco singled out? That's the first anomaly in this debate. It's because people are fanatical anti-tobacco people for whatever reason. I don't know why. And the other thing is that the study was done by the South African eminent economist, internationally respected Duncan Reekie, and a colleague on South Africa. I don't know about America, but in South Africa, revenue to government is more than government spends on tobacco-related illnesses. So tobacco smokers in South Africa, and the industry in general, the people working for it, paying taxes, the companies, the retailers, they contribute more than is spent.
Rachel, I want to come to you. Why is tobacco singled out? This is what Leon is asking, saying why tobacco? You've got fast food where people have got health problems because they're overweight. You've got sugar that causes huge problems as well, and so many other things. Why focus on just tobacco?
Liquor.
And he's talking about liquor as well.
Well, if I could respond to that, last year at the United Nations there was a high-level summit on non-communicable diseases, and they were looking at the 4 major NCDs that are rising rapidly all over the world, and they were looking at cancer, chronic lung disease, diabetes, hypertension. And out of these, there are 4 common risk factors, and tobacco is a risk factor for all of these illnesses. The other is unhealthy diet, lack of exercise, and alcohol. So it's not true that nobody is not focusing on unhealthy food or not focusing on alcohol. If I can point out, there are many countries that have got alcohol restrictions because of the dangers posed by excessive intake of alcohol. Attention is now turning to the whole issue of diet. And if you look, for example, at campaigns that the mayor of New York is running, he is trying to rein in the fast food industry because they are marketing a product that is harmful to people.
Rachel,
and even if you look at what is happening, yes?
Rachel, I do want to ask you about I mean, I know we're not talking about alcohol today, but I mean, some of the countries that are known to have very, very restrictive alcohol legislation are also very restrictive in a number of areas where you do find, and I'm not talking about all of them, but the majority of them, you find that in those countries that people's freedoms, not just in alcohol consumption, are infringed on.
Well, we are not talking about infringing on people's rights. We are talking about the state's responsibility to protect its citizens and to take care of them. And so when you look at taxpayers paying money and what those taxpayers' money is spent on, you want to avoid things that are preventable. And so illnesses rising from tobacco use are preventable if people would stop smoking and if young people wouldn't start. Illnesses caused by excessive alcohol intake are preventable. And so we have enough of a hard time in Africa dealing with malaria and HIV/AIDS before we add illnesses that can be prevented. And so when government is taking action to prevent an epidemic that is rising and that is rising rapidly, I think it's unreasonable then to say that government is being excessive. And then I just wanted to respond to something that Leon said. It's not really the tobacco industry that's paying taxes, it's smokers that are paying taxes. And so the tobacco industry is just collecting the taxes that smokers pay. And those same smokers who are taxpayers, if they bought something else, would still pay the same taxes. So it is not the industry paying taxes, it is the citizens paying taxes.
How do you even respond to that?
I agree with that. The smokers pay for more than the cost to the state. That is absolutely correct. Let me just make the point, the real difference between Rachel and me, and she said it now 3 or 4 times, is she's not for rights. She thinks that if the state can be a nanny state and determine your health, then it should be free to do so. That is really the difference. The difference here is about whether you believe in personal freedom or whether you believe that everyone should be governed in their lifestyle. And if you accept lifestyle control, as she has said, is now on the way, we must understand this, controlling junk food. Some countries have compulsory exercise. Being obese is illegal. That is where we're going. Now, if that's the kind of society you want to live in, which apparently Rachel does, I don't. That is really the difference between us. It's actually got nothing to do with smoking.
Rachel, are you in agreement that that is the main difference between your argument and Leon's argument, that he's talking about living in a free society and having the freedom to choose what it is that you want to do, and what you're saying is that at the end of the day you do have to look at whether people are doing the right thing or not, and if they're doing the wrong thing, in which case this is the argument for anti-tobacco laws, then you should infringe on that right, because they are actually not only doing harm to themselves but to others.
Well, I think we are forgetting something here, that nicotine is addictive. And the reason that people smoke cigarettes, they may start as a choice, but they continue because of addiction.
But Rachel,
and so it's not really an issue of I choose to smoke. Yes.
Rachel, what I would like you to speak to is the issue of freedom. And I think that's the premise on which we started the argument.
And that's what I'm responding to. That an addict to something is not really exercising a choice. They have to give way to addiction. And so cigarettes are addictive because of nicotine. And so a bulk of smokers, if you were to ask them, are no longer smoking out of choice, they're smoking out of addiction. So we are not talking about a nanny state that's interfering with people's rights. We are talking about a state that is trying to protect rights to health. And so the bulk of us are not smokers. Our rights to a clean and healthy air need to be protected by the state. And so the state is protecting those of us who have exercised our freedom not to smoke from having to associate with the smoke of those who have smoked. And so when you talk about rights, rights are not absolute. And so the rights of smokers extend as far as my nose does. And so when the nose of a non-smoker comes in contact with the smoke from a smoker, then the rights and freedoms of the non-smoker have to prevail. And that is what the state is protecting.
Rachel, thank you so much for joining us. Leon, thank you so much for joining us.